Effect of advanced reconstruction of vesicourethral spot for robot-assisted radical prostatectomy on early postoperative urinary incontinence. No potential conflict of interest to disclose. Various attempts have been made to improve urinary incontinence after prostatectomy. In recent years, the effect of ARVUS on early postoperative urinary incontinence has been reported, but the number of reports is still limited. In this study, we examined the effect of ARVUS after RARP on urinary incontinence. The study included patients who underwent RARP in our department from 2010 to 2012. Of the 231 patients satisfying the criteria, 61 patients were in the ARVUS group and 170 patients were in the non-ARVUS group. After propensity score matching, age, clinicality stage, and number sparing, 118 patients remained. ARVUS was performed after May 2019, except for nerve-sparing cases. Multi-stage nerve-sparing method was performed for all patients using the 4 grades of posterolateral prostate resection. Cystography was performed at the time of urethral catheter removal to measure the posterior uretrovesical angles and distance from the upper margin of the pubis to the neck of the bladder. Urinary incontinence was assessed by the total amount of incontinence for 24 hours on the day after removal of the urinary catheter, and 1 and 3 months after surgery using question 1 of ICI-QSF. The factors affecting the amount of urinary incontinence on the day after catheter removal were analyzed using univariate and multivariate analysis. Before propensity score matching, the patient tended to be younger in the non-ARVUS group, and a significant difference was found in clinical T-stage. After propensity score matching, no significant difference was observed, and patient background factors were adjusted. In the ARVUS group, the distance from the upper margin of the pubis to the neck of the bladder during cystography was significantly shorter, and posterior uretrovesical angles was significantly smaller. No obvious difference was observed in the amount of urinary incontinence for 24 hours on the day after catheter removal. However, when the cut-off value for incontinence volume on the day after catheter removal was set at 500 ml, the percentage of incontinence volume of 5 ml or less was significantly higher in the ARVUS group. No significant difference was found in the percentage of patients with an ICI-QSF score below 1 at 1 and 3 months after surgery between the ARVUS group and non-ARVUS group. And next, result of the factor affecting the amount of urinary incontinence on the day after catheter removal below 500 ml. In univariate analysis, the distance from the upper margin of the pubis to the neck of the bladder, posterior uretrovesical angles, and ARVUS varied significantly, and in multivariate analysis, the distance from the upper margin of the pubis to the neck of the bladder was identified as a predictor of urinary incontinence below 500 ml on the day after catheter removal. In the ARVUS group, the distance from the upper margin of the pubis to the neck of the bladder was significantly shortened, suggesting that ARVUS moved the urethra ventrally and increased urethral resistance, resulting in early postoperative urinary incontinence. In conclusion, ARVUS was found to be effective in early postoperative urinary incontinence. The distance from the upper margin of the pubis to the neck of the bladder on cystography was significantly shorter in the ARVUS group, suggesting that it may be a predictor of early postoperative urinary incontinence. Thank you.